Thank you very much, Dr. Hennessy and Dr. Heckler, for two excellent presentations. Eric, your presentation underscored the need, right, to focus more on dynamics, interconnectivity, context, and flows within and across systems, right, rather than just outcomes or interventions. And I really liked how Erin built on some of those same humanistic themes, right, using system tools and leverage points within the community, especially your emphasis on the processes of model building and system change. I think that will definitely speak to the roundtable members. So if you have any questions, please remember to put them in the chat box. We're going to have a shortened panel to keep us on time. And let me start with a question for both of you. You talked about the concept of power dynamics, right, in different ways within systems. Who has it? How do you use it? What's our definition or perception of power? What factors affect the decisions or outcomes within a group? This is obviously very timely given the current events. So thinking about that intersection of power and equity, are there any particular system tools or processes that you feel has been most useful in your work to address health equity within your community? And anyone can go first.
Erin, please.
Sure. Okay. Thank you, Eric. It's a big question. The first thought that comes to mind is how we've used CVSD and GMB specifically. We've had the pleasure of being able to work with multiple community coalitions across the US, and many of them have actually come to us expressing a desire and a need to advance their work to the next level. And I think oftentimes we have a specific question we have in our mind, but we've had to work and really kind of think about our own biases and dynamics at hand to make sure that we're building the coalition's capacity to be able to do this work, right? Our goal isn't to be there forever, but to think about how can the organizers and leaders of a particular coalition be trained in these techniques so they can take advantage of the trainings that we have and be able to use them over time. That's just not a one-time event, right? There's technical assistance and ongoing support that's needed for that. And what the right exit strategy is something that's ongoing in our work about how much support a community coalition needs to really be engaged in these different types of systems tools. But one thing that often comes up when we work with them over time to advance and think through their complex problem are some of the root causes that have come up and the challenges in the evidence base of how do we actually address the structural, the social determinants of health, and where is the evidence base that we're trying to guide them on how to do that. So there's a real tension, I think. GMB and CVSD help equalize power dynamics, but who's at the table, why they're at the table are constant questions that we're asking ourselves and the coalitions are asking themselves, and where and how we're going with our work and what evidence-based strategies they'll be able to implement are things that we're still challenged with.
Yeah, and knowing we're going to get to the group, I'll try to keep it brief, but I didn't brief everything Erin said. Yes, I didn't get a chance to talk about it, but a kind of third wave for the kind of work that I do has been much more in the questions of collective action. So, and that in many ways was inspired by this kind of earlier observation of with good intent, you can still do an incredible amount of harm. And I think we've fallen into that trap quite a bit in our work and logic, even from starting from Aristotle and to Enlightenment period logic, where we think of these sort of universal truths and don't realize the connectivity between generalization and colonization as constructs. And so with that as all sort of saying, I think a key, in my mind, some of the key lessons learned is actually to just spend time reading history, engaging in social constructivist working and learning from sociology, from anthropology, from economics, particularly economics focusing more on inequities, work like Thomas Piketty's work and otherwise. There's so much, once we start digging into the depths of this, that you can really start to just recognize these deep systemic issues that I think that a lot of times people engaging in computation, or those who are, I was trained at Stanford, so to kind of make fun of Silicon Valley for a minute, those who kind of take that moment as someone who was part of that family for a while, right? That idea of like, oh, I'm going to go out and conquer the world. Well, that's actually a colonizing language that you just used, right? And so I think really building that awareness, and then coupling that with actually knowing that micro actions, we think of them as microaggressions as one example, really do matter, coming back to these dynamics, right? And so learning your capacity to notice when you fell into traps, and noticing that that even in your small actions, or noticing if you particularly as a white male of privilege, like when I speak up, if there's not a space that is safe for other people to talk, I'm never going to hear the feedback. And so I'm going to be able to propagate my confident ignorance. So a precondition to a conversation is to build safety, to be worthy of someone else's trust. And that's very much a lot of work on the person and the individual themselves, particularly those who are vested, not because they deserve it, but just because of the cultural norms that we have, the social constructivist norms we have to have power, right? To really consciously work to build spaces and be worthy of someone else's trust as you try to serve them.
Thank you. And we have a follow-up question to this discussion to Eric, but Erin, I would love to hear your thoughts on it too. How do you teach humility?
Wow, that's a big question.
That is a big question.
My short answer is I don't know. My personal set, I guess, like my gut reaction, knowing that I don't know, and I'd honestly love to hear everyone's thoughts.
That's humility, right there. To be vulnerable enough to say you don't know.
Yeah, but so I guess there's that. But and I think in my mind, it's sort of, at least the way I think about it, is like just being willing to kind of commit to values and virtues is a really important part of this, where it's not about committed to being right. This is what I was getting at when I was talking about that sort of third thing of paranoia, of losing power. In my mind, there's a lot of people who because of insecurities, because of anxieties, they can fall into like, well, you're going to steal my power and then you're not going to be safe. And then you project that, not to get too Freudian, you project that on other people, right? And so it's sort of like building enough confidence in yourself such that you can actually be humble and to care for others and commit towards the values and principles that we all share, I think is a key part of it, really committing to those principles rather than trying to commit towards just selfish self-betterment and whatnot. But I don't know, that's a horrible answer. But
I don't really have a correct answer because I've never attempted to teach it, but in reflecting upon my own training and where perhaps there have been touch points that have helped me be aware of it. My orientation comes from community health and working and understanding and learning in the space of community-based participatory research. And I think that orientation in and of itself really lends itself to being able to identify with the concept of humility. I shun at the words academia and thinking that I'm somehow an expert and somehow a community coalition member is not. I think that's absurd. But I think if we all kind of step back and think we all have expertise and we all need to bring it to the table to address a complex problem like obesity. So some of it is, it's not a teach like it's a course, right? It's a lifelong journey toward understanding it.
Yeah, those are good points. My mother would always say that humility comes from gratitude. Right, you have to see people and be grateful for what they bring to the table, then humility follows. So we have a really good question from one of our roundtable members, Patty Neese. She says, most of the models we've seen today revolve around factors that can be changed. How about a systems model that takes into account those factors that cannot be changed? So for example, the biology of obesity, genetics, things like that, or epigenetics.
I'm going to let Eric go first since he started with the behavior change.
Okay, sure.
Yes.
Thank you.
You're welcome.
So I don't mean to be crass, but I want to actually challenge the premise of this question. And really this question of like, what is it that can't be changed? Like you brought up genetics as one example, but then of course the follow-up of epigenetics, genes are activated and deactivated depending on the context and conditions that they reside within. And so, now, of course, there are going to be some things that are truly immutable, but I mean, I go back to like Heraclitus, the only constant is change. I think it's an important thing for us to really carefully think through what are those things that are truly immutable versus those things that are evolving. Even the things that we frame as immutable, depending on the time scale we're using, mountains, ecosystems, climates, they are still changing. They're just at a much slower time scale than we might be aware of. Just like as a whale has a slower time scale in terms of how it lives, we might see that as immutable, but it's a different time scale than our human mind normally engages with. So I'm sorry if that was not at all an answer to your question, because I actually don't know if I totally agree with the premise, to be frank, but I'd love to hear a reaction to that. I think that we want to be looking at how dynamics and things are moving and altering.
My response would be around, it depends on the nature of the question that's being asked. There are models, systems models that have tried to explore what some would frame as non-modifiable and others would frame as modifiable, factors. I think a model can only be so useful as it's simple and parsimonious. If it gets too big and complex, you really can't generate any insights from it. So there's a real tension, I think. And I want to echo Dr. Diaz-Ru's comment that these are tools in our toolbox that should be used in complementary ways with other epidemiological tools to be able to answer all of the questions that we have. I don't necessarily know if we can answer such a huge problem by one model in and of itself.
Those are really good points. Obviously, biology is in our group model a causal map that we built as part of the roundtable. So I'm sure this will come up at our meeting tomorrow as a discussion point. We have one question for you, Erin, and it talks about Shape Up Somerville project. Says, this is again from a roundtable member, Jody Mitchell. I know you've done similar work in other communities as well. Can you talk about some of the lessons learned as far as what has been similar across communities and what's been some of the unique differences?
Sure, that's a great question. And I think it's one that we're hoping to explore more explicitly because, one of the things that I've been thinking about over the past decade is sort of the concept of, no two communities are alike, but is there enough similarity across some of the contextual factors of communities, the problems that they're trying to address, the policies and practices that we know that are keeping obesity sort of at its equilibrium point, that we could actually glean some type of higher level architecture of how community coalitions like the Shape Up Somerville Task Force can go about their work. And we think there are. I think one is, sort of the idea of which sectors and settings need to be at the table. We're getting more clarity about some of the newer members of the team that need to be engaged. And sometimes there's a couple of members here and there across communities that might be different based on the dynamic problem that the community coalition is hoping to address. So I think sort of the composition is one of the similarities across different communities. I think another similarity is that you can do important, powerful, dynamic work without a ton of resources. So you might have to get scrappy and innovative, but the goal isn't to infuse, hundreds of thousands of dollars that then go away and you're left kind of back at the same place that you started. And so by leveraging the power of relationships and connections and really thinking explicitly about the resource flows, yes, you may need some new dollars to do some new things, but the power of the group can really be insightful and generate and diffuse evidence-based interventions without a ton of resources to be able to do them. Some of the things that are different, obviously, are the contextual factors that are at play. There are some different political dynamics going on in different communities, depending on where they are in the United States. Sometimes I would say their conceptualization of the problems for their community slightly differ, but I think there is a lot of similarity in the causal loop diagrams that the different coalitions have been able to create and put forward. And we're excited to try to think and step back and be able to put that forward to the group to learn from.
Thank you. I think we have a couple more minutes. We had a response to that earlier question about non-modifiable factors that may be in models, and Patty raised having hormonal reactions to weight loss, for instance. And I think it's really complex. I mean, anytime you're in biology, for instance, there's so many different aspects of it. And since we have about a minute or two, maybe I'll put that in the parking lot for the bigger roundtable group again to discuss it. Let me end with a question for you, Eric. We have about a minute. And when you did your presentation, you talked a little bit about the skill as a scientist, right? Because you talked about your own evolution of growth. And you talked about fusion and diffusion as a skill scientists should have. What do you mean by that? And how do you see that affecting system science in a way that may be applicable to obesity?
Thank you for that, and checking in on that. So in my mind, it comes down to the sort of the logic of objectivism, and I think as all the talks that I think have preceded this have set up, like we are humans and we humans are doing the science, and therefore we are bringing in our systemic biases. And so in my mind, the logic of trying to be objective is actually a false ideal that we won't be able to achieve, and I won't be able to chance to get into all the philosophy on that. But like in terms of the idea of fusion and diffusion, it's from the, I was trained in acceptance and commitment therapy. I've been trained as a psychologist, clinical psychologist. And the general idea is knowing how to both fuse with your experience. For example, you can say the word, I am angry, versus defusing from your experience. I am having the experience of anger. And you can keep diffusing to many different levels. I'm having the experience of anger in my home. I'm having the experience of anger with others in my home. I'm having the experience of anger in my home in San Diego. And you start basically knowing how to zoom out, almost like that powers of 10 capacity. Why is that important? It's allowing yourself to see how you are part of the system. As one of my postdocs likes to frame, like when we do our community work, oftentimes people complain about traffic, but it's really important to remember when you are sitting in a car, you are traffic. You are part of that, just like we are part of the community, very much in line with what Erin was just saying, And so learning how there are times when to be members of the community, you need to fuse with yourself. You need to be emotionally and fully present with others. And at other times, you need to diffuse from yourself and to be able to see how you might be bringing in systemic biases. And I think it's a really critical skill that I think is beyond objectivism, that allows us to really acknowledge that humans do science. And we need to remember that.
Well, thank you. We've come to the end of our session. Thank you for everyone in the audience for your questions. And a big thank you to our two wonderful speakers. For terrific presentation and their remarks. We'll now break for lunch. Please be sure to join us back at 2 p.m. promptly for our final session on case studies from the field. You don't want to miss that. Thank you.